Now we'll coming towards the next slide, which is the some of the techniques that now you have talked to your client, you have conceptualized the problem. Now you know that the person. So, cognitive therapy, behavioral therapy, there are some techniques. Then comes the techniques. Now you know that what kind of a core belief your client is having, or you are having if you're working on yourself. Then comes that what is the cognitive distortions they are using, and then you will see that because of those cognitive distortions, what kind of uh, negative thoughts they are having. So now you, what are you going to do to help them, or what are you going to do to help yourself? What are the techniques you're going to use? So please, can you do the next slide? Yeah, it is already there, right? So there are few, there are not like the whole of the techniques. There are many techniques. So one is the reframing. Reframing is basically when you will find out their cognitive beliefs, you will talk to them, you will question them, and you will question them in a way that they start questioning their core beliefs. So do you really think, do you have any evidence? That is one of the most used question. That is very helpful question that you will ask them. Do you have any evidence? If somebody is saying that nobody loves me, what is the evidence do you have? If somebody is coming and saying, okay, I'm not good enough, okay, what is the evidence you have for that? Maybe they will tell you, okay, this and this, and then you can tell them, how they are thinking wrong. And then you can question them even more, and maybe they will come to the conclusion that they are thinking wrong. So reframing, the other thing is homework. In CBT, we give homework. Sorry, I forget to mention that in the start. CBT is basically, we normally do it once a week, 45 to 60-minute session once a week. Like you will decide a day, or maybe any day. It's like once a week, and then it's like majorly it goes for four months. Like 16 weeks, which is 4 months. And then obviously you try to decline it with time. Then they will start coming twice a month, then once a month, and then you end it, depending on their improvement, and how improved they are, and how many coping strategies they have developed. In CBT, we are making the client his own therapist. We are giving him all the techniques you need for the therapy, right? You are giving them all the coping strategies, so they don't require you every day, and they don't require you their whole life. You are giving them the coping strategies so they can actually help themselves in the future. So that is very important part of CBT. And another thing which is in CBT is that you try to tell your client that the event is not important. Whatever is happening in their life, the event doesn't matter. The meaning you give to that event, that matters. And the moment they will understand this is all about thinking, and the way they are perceiving that event, they are going to change. Anything which is happening in their life, they definitely start getting better. So you need to first tell them that. So homework is basically, because they are coming to you once a week for like 45 to 60 minutes, which is not enough. So you will give them some kind of homework to do in the whole week. You can give them to write down their own thoughts, to write down their negative thoughts and then change them into positive. Or you can give them some kind of exercise that you can go and do, meditate, do yoga, or maybe if some physical activity is required, you can ask them to start doing meditation and all of that, right? Then comes the thought record. You can give them the thought record as a homework, or you can also ask them to do thought record while they are in your clinic, and you can ask them to write down their thoughts, and then you can work on them with the client, and you can see that how you can change those thoughts into positive. Then comes the journaling. You can ask them to start journaling, because journaling is very helpful. It's kind of a catharsis. They will write everything down, and once they will write it, definitely it is going to be very cathartic for them, and they can improve. There are many others actually. Normal, if we talk about like normal things, but you can, suggest to your clients, which are kind of helping them in their negative thoughts, like stopping their negative thoughts or reframing their negative thoughts. You can ask them to start doing some physical exercises. You can start them to do affirmations. They can write the affirmations on their mirrors. They can write the affirmations on their desktops, on their wallpapers, and they can, read them again and again. If somebody is thinking that I'm not enough, simply tell them to read I'm enough every day, because whatever you read, it starts becoming your reality, because then you start believing on it more. Sometimes all we need is something which we are just reading again and again and again. Some people can work on themselves, some people need help. So you're going to help them if they cannot. Then gratitude practice. Gratitude practice is so important. Gratitude practice is like, gratitude is thankfulness. So you will give them homework to write down 5 things they're thankful about every day, or they can write down 5 things every day at night or in the morning, or in night is better, because they can write whatever happened in the day, whole day, and what are the good things that happened that day. So mindful breathing, mindfulness is very important, like being in the moment where you are, staying in the present moment, that is really important. Then distractions. The important thing is to not make your thoughts so important. Your thoughts are not facts. Your thoughts are not your reality. Thoughts are just something which are coming, and then they are definitely going. So thoughts are not everything. We are on the slide number uh, 11 right now. So, and then distractions is very important. Like if you start watching a movie and get so immersed in that you're not thinking about anything else at that time. Or maybe a hobby, like I like coloring a lot. I like journaling and coloring is my hobby. So having a hobby can help you. You don't focusing on the negative part, negative thoughts. You're focusing on something else. You have a distraction. So now what how can you change your thoughts? Already I'm telling you what you can do, but if we just focus on the thought system, then you first, very important, you need to identify the distortion with the client. You need to sit and see that what is the distortion they are having. Then you need to see if there is any evidence for it. You can ask them that if there is any evidence, and there is a huge chance there will be no evidence. Also, if there is like, whatever their negative thoughts are about themselves, you can ask them to, it is called the double standard method. Ask them that who is your best friend. Will you ever say this to your best friend? So definitely you will never go and say to your best friend, you are not enough, you are a failure, you don't deserve any love. You never say that to your best friend. So the things don't say to your best friend, don't just say those things to yourself, because you need to be your own best friend. Then the experimental technique. So when you have a negative thought, ask yourself if there is any way you could test it to find out if it is really true. Like you need to sit and see that, is there is any way it can be true. Like, if do I have any evidence or any a reason to think like that. And there is a huge chance that if it is just your negative thought, you don't have anything like that. So that is going to go away automatically. And then thinking in gray. When your life will become really easy if you will start thinking in a gray area. You will stop thinking about it like it's all white or all black, it's all good or all bad. It's always nobody and no event is all bad or all good. If you cannot say that this is all white and this person is just this person only has good things in them. No, we are all human beings. We have good parts, we have bad parts. Same with the events. This is life. Every event has its positive and negative consequences. So you cannot just say that. right? So then comes the survey method. uh, you need to ask yourself, first question, would other people agree that this thought is valid? So it's better if you have like some close friends or some close people you really trust. You can ask them, I'm thinking this, if do you think that it is actually true? And they will be, if you need to find people who are honest with you and who are loyal with you, and I'm sure that they will tell you the truth. That is a survey method. Or you can simply ask people, or you can simply, if you don't have the people, you can think about the people and then think, will they say that this is true? And you will know that many people will not say that. People who, especially who love you, will never say that this is true. So the other thing is the defined terms. Especially useful if you're putting yourself down, and you need to think about it, that what is a failure. If somebody thinks like that, I am a fool, what is a fool? Then you will know that when you will define it, you will know that it is not the truth. It is not how this world is um, working. This is not the truth. Then the semantic method, which is should statements, or if you are using should statements, if you are using must statements, and I should do this, I must do this, then this is very helpful for the people who do that. So what is the substitute phrase for this, like should and must, is that it would be nice, it would be preferable, or instead of the I should. So when you take the should and must out, then it becomes something you're doing for yourself, and because you're happy, that's why. And it makes you happy, and that is something which is helping you, not something which is putting pressure on you. So should statements should not be a part of your life. Should statements should That's ironic, but should statements should not be a part of your life. So then comes the reattribution. If you're using personalization, I already told you about the cognitive distortion personalization. So you can ask yourself, what other factors may have contributed to this problem? Like if it's just me, or there are other things as well. So when the perspective of looking at things change, the things you're looking at actually change. If you will change the way you look at things, the things you look at change. That is the whole concept of therapy. That you are looking at something with a blue glasses on, you will see all blue. If you will put the yellow glasses on, everything will be yellow. So if you will look at an event and you will think that this is the worst event of my life, I have never felt this bad, then you will feel that. If you will tell yourself that fine, it was a it was a bit serious, and it was a bit difficult event, and I went through a difficult time, it's okay. I'm strong enough. I have the coping strategies. I will deal with it. So that becomes your reality. And what is change? Thinking. So everything which is changing, which is happening, is basically because of your thinking. Okay, so there is an exercise. You can help your clients with that, or you can do it for yourself. Like, first thing, if you're feeling bad or negative, you have to see that what is the trigger, what happened, where, when, who, how, everything. Analyze it. To make yourself happy, you have to be, you need to work. To be the best self, you need to work. So first step is like find out the trigger, the situation. Then what are the feelings or emotions you're having, like what emotion did I feel at the time? Then comes the third step, which is unhelpful thoughts and images because of that event, and then because of that emotion, what are the help? And like, for example, your boss was rude to you. That is the trigger. Your boss, and at that time you felt embarrassed, you felt sad, you felt hurt. What are the emotions you had at that time? And then what are the thoughts you're having? I should leave this job. I should take revenge. I should do something about this. The fact that, or maybe I'm helpless, I'm hopeless, and then you definitely It will take you towards depression. So these kind of thoughts, definitely. And the fourth is facts that support the unhelpful thought. What are the facts? If there are any facts, what facts do I have that the unhelpful thoughts um, are totally true? Then fact against the unhelpful thought. Like now you need to also think about what are the reasons, what are the facts I have which tell me that this thought is not true, so I can just let it go. Okay, this is how I felt for the moment, and now I need to let it go. What are the facts? Maybe you will find some reasons that it's not totally true and you are thinking in a negative way, or you're making it something it is not actually. Alternative, more balanced perspective, then you will find some more balanced perspective, obviously, because now you know that this thought is not a fact. Then you will find an alternative thought for it. And then the outcome, what I'm feeling now, what would I do differently, and what are the behaviors you are having, and then you can change it. Okay, so this is it. This is what CBT's overview is. Definitely, CBT is not something we can cover in 45 minutes or in an hour. We need like more and more lectures for that. And CBT comes, you can only understand it once you will practice it. So if anyone has any question, they can tell me. There are some questions I can see in the chat, in call messages. So if anyone wants to ask the question, you just simply unmute and talk.
Hello, ma'am.
Yeah.
Ma'am, I have first of all, I want to say something. That is, thank you so much for your unwavering professionalism and being an exceptional trainer.
Thank you.
And here is my question: that how can CPT be applied to daily life outside of therapy sessions? Like, are there any self-help resources or exercise that you can recommend to us?
Yes, definitely. And I have already told you some of them, that you can always start journaling. Journaling is one of the most helpful exercises of CBT. You need to start writing things down. You need to start analyzing. You will find, if you use Pinterest or even on Google, you will find so many helpful planners and journals, and where we call it dysfunctional thought record, which is DTR. I'm again saying it, dysfunctional thought record. So you can always write down your negative thoughts, and then you can convert them into positive. You can sit and see, these are my negative thoughts, these are the dysfunctional thoughts. So you can now change them into positive ones. There are many worksheets available. There are many things available you can do. And the most important thing is that ask yourself at least 3 to 4 times a day, what am I feeling? And when you will see that you're not feeling good, always go to the thought, that what is the thought I'm having right now. And I can bet the thought you're having is most probably a stupidest thought and something which is not that important. Then you can think that, why I'm thinking about this event. Yeah, is it like, if it is not happening to you in the next 5 minutes, don't think about it, right? So another thing is, which you can do, is start practicing living in the moment. Like, you need to start living in this moment where you are right now. Mindful practices, CBT also works with mindfulness. Mindfulness is so important, that if I am here talking to you people, I should be here talking to you people, not thinking about the future and the past and what is going to happen in next 50 days or next year, or what is going to happen in my old age. Because it's everyday practices you can learn, and start reading about it. The more you will read about CBT, the more you will know how you can deal with it. The first step is understanding CBT properly. No matter how many techniques I tell you, no matter how many lectures I give you, until or unless you will not read about it, until or unless you will not start working with it, that is not going to help you. So the first thing which you really need to, and you should be doing, is working on yourself and reading about it.
All right, ma'am. Thank you so much.
You're most welcome. Is there anyone else who wants to ask a question?
There's 11 minutes left in the meeting. If anyone have a question, please go ahead.
There's a question in the in chat, in call messages. Mispa Mughal has asked that, ma'am, does CBT help in self-talk? Obviously, CBT helps with almost every disorder you're having. So even if it's self-talk or anything, you need to then go to a therapist and find out the reason why the self-talk is happening. And self-talk is, if self-talk is negative, that is creating some more disorders for you and you're not aware of it. So you need to first find out that what kind of self-talk you are having. And definitely with some minor changes in your life, and with have maybe you're not having more friends, or maybe you're unable to share your stuff with the people who are around you, that's why you're having self-talk issues. अजरा, दरवाजा बंद करके कर लो. How can we convince anyone to change their negative thinking already made up many years before? Don't convince. Sabah Bilal has asked, why would you convince anyone? This is for you. CBT is a collaboration therapy. If many people come to me and they're like, we want you to meet somebody, and they don't know that you're giving them therapy, but you just talk to them. And in the start, I was so naive and didn't know about things that well. So I used to be like, okay. And now I'm like, no, if the other person is not ready to take the therapy, I cannot do anything. I'm not a magician.
Oh, ma'am, if there is a person who has so much negativity and who has just made now concrete statements about something because of his or her past bad and worse experiences, so how can we uh, take her or him out of all that chaos and like that?
My question is, that person wants to get out of it, or they are aware of it, they want to change?
Yes, considering he or she is willing or interested.
If he or she is willing or interested, number one thing which you need to do is that refer them to a therapist. If you are not a therapist yourself, if you will do it and you are not a therapist, you are definitely going to have a lot of giving that person a lot of time, and then outcome will be like very minute, maybe a minor change or not. So the person needs to go to a therapist. This need to start start talking about the things, whatever is giving them this negative thinking, and whatever the things which are their early life experiences. Definitely we do not know about their early life experiences, we cannot do anything about them. So the first thing is that you need to, and they need, if they are willing enough, ask them to watch a lot of videos about CBT. Ask them to read about different things. There are some really good books they can read. There are some really good self-help books. Self-help is not therapy, but there are some self-help books which are even therapists recommended by therapists, because they are so well written. So they can read those, start reading the books, they can start writing, they can start journaling. It is a two-way street. If they are just putting the pressure on you that you need to change me, you're never going to achieve that. So
Yes, ma'am, because it is kind of partial willingness because uh, uh, the family of the person himself is not at all would be convinced to consult with the expert or professional therapist. So this is why, and it would be a general question as well. Maybe someone would come across with such situation where he or she will have to take such initiative, like you just mentioned some of the tips. So thank you so much, and if you would please add some more tips regarding that. So
I will definitely do that, but we do so. I don't know about the person, but we do so many things. If the person, if anyone is going through that, we do so many things, not telling our parents. And now online therapy is like so easily available. There are some platforms who are giving you online therapy, and yes, definitely you will have to like save 1,000 rupees or maybe 1,500 or maybe 2,000 rupees, and even I give online therapy only in 1,000 rupees. So 1,000 is nothing. You can definitely do that, and we are on our phone all the time. You cannot get 1 hour. You cannot sit and talk to a person and send. This is not that difficult. We need to be willing enough to do that. There are so many things we do, and we don't tell our we but when we want to have fun or when we want to do something, we don't tell our family. There are many people I know who do that. So when it comes to therapy, we start saying that, we don't have the resources, or we don't have the we have the resources, and we convince our family if we want to go on some event, or if we want to buy something, so we can do that. We need to understand that. And if somebody is not willing enough, just give them some advices and some tips, and then just let them be. Make them understand that, and one day when they will have the enough motivation, they will find out a way.
And ma'am, I would like to request you, and I would like to request the admin as well, if they would please just, mention the email address of the trainer or instructor so we can get in contact with them later.
I am sharing in messages my email address. If they can share the other trainers, I don't know. I don't, and I'm so sorry, somebody outside of my house, there is a kid crying. I don't know whose kid is that.
Ma'am, thank you so much for considering this request to be accepted.
And that's my Insta. I'm also sharing my Insta, so you people can, follow if you want any help. It's better to send me a message on Insta instead of email, but email is
Sure.
also fine. I check my email.
Okay, ma'am, thank you so much, and
Most
we are
welcome.
grateful to
No issue.
have such a kind response.
No, 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 not at all. Actually, ma'am, sometimes overthinking can lead to negative thoughts. How can we deal with that? Don't do overthinking. Have a life. Have a scheduled life. Do plan. Have planners. आपको free में Pinterest पे, आपको free में Google पे बहुत सारे. Oh, sorry, I am not supposed to talk in Urdu. So sorry. So there. You will find many planners on Pinterest, and you will find many planners on Google. Have planners, have a planned life. That is one tip I can give to all of you who wants to be a psychologist, who wants to be a professional. Start planning. Have a strategic life. You should know that what you're going to do today, and then you need to have a busy life. Don't have the time for overthinking. When you will have like, I mean, right now, when you, like, if I talk about myself, there are many things pending, and I think that this is good. I am happy with pending stuff instead of not having to do anything. So whenever I get the free time, I want to spend it doing something which I love to do, like watching a movie or coloring or doing something like that, instead of thinking. So have a life full of things where you are reading books, you are watching movies, you are consuming happy content. This happens this is not very common. You need to be then more busy. If somebody is saying that they're busy and still having overthinking, then it means that you need to be more busy, and the things you are busy in, that should be changed. Maybe something which you really enjoy doing, then you will be so immersed in that. For your time, you all of you share something. You're welcome, everyone who is saying how to overcome your depression about.
Um,
Yeah.
Ma'am, the meeting is about to end, so I have to
Yes.
just say
There
thank you
are
so
some
much.
questions left. I am
Yes.
so sorry if I haven't. And thank you so very much. All the people who are saying thank you. It's all my pleasure anytime.